Twilight or general anesthesia. Can a facelift and a brow lift be done under twilight anesthesia, or does it have to be done under general anesthesia? Thank you.
Thank you for your question. You're asking your question, can a brow lift and facelift be done under twilight anesthesia, or does it have to be done under general anesthesia? It's a very simple question, and I can certainly give you my perspective and how I practice and what my preference is. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon practicing in Manhattan and Long Island for over 20 years. Brow lifts and facelifts is a very significant part of the procedures I perform, as well as cosmetic eyelid surgery. So I can tell you how I developed what I've done in my practice, because I think that it's a very important question at many levels. Well, first of all, to answer the question directly, the answer is yes, you can do these procedures under twilight anesthesia and avoid general anesthesia. Now, the question then becomes why and what are the pros and cons? Well, I can tell you that in my experience, and when I trained in cosmetic surgery, a lot of the people who I learned from preferred to do their procedures under general anesthesia. But this was in the early 90s, and this was a time when a lot of the people who were having these cosmetic procedures were people who were kind of accustomed to a certain process of going into a hospital or going into a surgery center, having general anesthesia, and then going somewhere to recover, often in the hospital or in an outpatient surgery overnight facility. Once I went into practice, I quickly realized that the majority of people that I was taking care of were people who, regardless of what level of their socioeconomic status was, they were too busy and they did not want prolonged healing time and recovery. And so from what I saw during my training, I saw that a lot of people, the surgery would be great and no problem, but it was the anesthesia recovery that really took its toll. And I always felt that the less you put somebody under deep or general anesthesia, the safer the procedure becomes. So what I advocated from the beginning was local anesthesia with light sedation. Light sedation means getting a little bit of a liquid Valium or propofol to help reduce anxiety. But what's wonderful about what we do is the areas that we treat are very straightforward to numb. And a colleague of ours who's a dermatologist invented a method, Dr. Jeff Klein, who invented a method of local anesthetic called tumescent anesthesia. And he did this in the mid-80s. And it changed how the practice of liposuction was done. And it literally saved, I would say, hundreds and hundreds of lives over the many years of people who would have otherwise had complications from traditional liposuction. My point is that in our practice, what we do is we combine a modified version of that tumescent anesthetic method with light intravenous sedation, and for 20 years it's been working extremely well. I like doing the procedures in a way where my patients are able to get up and walk out and be comfortable, and they go home. They don't need these types of special aftercare. And this includes patients who I do full, extensive face and neck lift surgery. It's not like it's limited to mini lifts or limited procedures. Doing a full face and neck lift with cheek implants, chin implants, platysmoplasty, deep plane, you name it, can be done under local anesthesia with sedation. Now, it is still important that you have this conversation with your prospective surgeon. A lot of times you just want to use your judgment If a procedure is going to be done under local anesthesia and it's going to be a shortcut procedure or it's going to be rushed, well, that's not acceptable. What you want is you want the benefit of the best procedure for you and make sure that the procedure is done in the safest way that is right for you. Now, in no means am I disparaging any surgeons who do general anesthesia. In fact, a lot of my friends and colleagues do use general anesthesia. That's what they're comfortable with, and they and their patients have that understanding. But for the people who come to me, and patients come to me from all over the world, they really like that they don't have to be put under general anesthesia. Have a tube in their throat, be put on a respirator, and then the risks that are associated with that. The medical literature continuously reinforces the proof that local anesthesia and local anesthesia with limited sedation is considerably safer for patients than general anesthesia. I also feel that when I do this type of procedure, I'm actually doing the procedure more accurately. And the reason is there's no tube or anything distorting the face. The patient is not paralyzed. And so I'm actually, and I see this as living sculpting, I'm actually able to do the procedure and get a better sense of what the person will look like after the procedure is done. Again, this is a personal approach, and by no means does that mean anyone else's approach is bad. It's just how I approach and take care of my patients. Basically, I use the same rule. If I do for my family, I do for my patients, and for me that means local anesthesia with light sedation is preferred unless there's no other option than general anesthesia, and then there has to be a good meeting of the minds. So I hope that was helpful. I wish you the best of luck, and thank you for your question.